Pulmonary rehabilitation is a programme that's individualised for the patient around exercise and education. It's to basically improve quality of life for that patient by strengthening their lung health, which then makes them stronger and able to then do their daily activities more efficiently.
It's one of the most evidence-based interventions that we've got for people with COPD and breathing difficulties. The science backs up how important it is. We know from research that it works really well and it improves outcomes for patients. It allows them to live their lives in a better way. It helps them to breathe more easily. It prevents them from becoming more unwell. It prevents hospital admissions and requirements for things like steroids and other interventions and other medications as well. So it's a really vital part of the treatment for people with COPD.
It's, I think, beyond important. In my clinic at the doctor's surgery, Leicestershire surgery, I don't know whether it was the first or second meeting that I had with the staff there, it was suggested to me. I knew nothing about this. I had no idea that it existed. When somebody's diagnosed with any illness, it's her. Like a lot of patients that I've found, there was a heck of a lot that I didn't know. You know, how to use the medication was one of the main things, and the correct exercises, what I should be doing, what I shouldn't be doing. There was so much to learn. There is no way that I can emphasize how important it is. So the very first class that I came to, I was like every human being is new. So I think, okay, what's this? Within, I think, minutes, no more, I can repeat the staff that were here. I felt so at home. I had 6 weeks of just joy. I just loved. Well, you've got to love something to be prepared to go through 3 months of questions and checkups and goodness knows. That's, I think, says it all.
The patient will be referred usually by the GP practice. They're then triaged. The team will then contact that patient and book them in. They'll carry out a holistic assessment, so they'll go through absolutely everything with that patient, get to know the patient better. You know, what are their areas of concern? What aspects of their health do they want to improve? What do they want to get out of the rehab programme? They'll be booked in to do a walking assessment. That can then gauge what level they're at. After that, they'll be booked into the next available course, and they'll start the programme from there. Patients
are often apprehensive when you tell them about pulmonary rehab, because they think, oh gosh, well, exercise is the thing that makes me breathless, and I fear being breathless. So why would I want to go and do an exercise class? I think people often have that initial fear and worry, so they shut down sometimes and think, well, that's not for me. But the real important thing is to explain what a pulmonary rehab class involves, that actually the exercise is tailored to the needs of the individual patient. Nobody's going to ask them to do anything that is beyond them. It's all going to be tailored by a specialist physiotherapist who knows what is safe for the patient to do. They may push them beyond their comfort zone, but that will allow them to improve and to gain strength and confidence. You know, it's a great experience as a doctor to be able to send somebody for a treatment and a therapy, and for them to come back and tell me how well it's gone and how much it's improved their quality of life.
I don't think you realise how bad you are until you start. And then you think, oh crikey, that's not actually very good, is it? And then when you finish, you think, actually it does make a difference. It does. It's amazing. I saw a big difference from start to finish for me and a lot of other people. And I'm walking the dog for an hour at least. But I'm doing, before 9 o'clock this morning, I'd done 5,000 steps. Now before that, I perhaps did 2. So I'm doing on average, before I didn't do nowhere near that. And I'm doing probably about between 10 and 15,000 steps a day. They were really good at putting people at ease and you know, letting you know that it's all right to feel a bit anxious and stuff. So, but yeah, I just feel better. I feel better myself.
The team are able to alleviate those concerns, those worries that the patient might have. There are clinicians of different backgrounds. We have physiotherapists, we have occupational therapists, and we also have nurses that come to the venues to deliver the education sessions as well. The patients can expect to have a multidisciplinary approach to their treatment as well. I think it's great that they can speak to other patients that have got similar symptoms.
Pulmonary rehab in the future, I think there's lots of potential for doing it in different ways. In an ideal world, we want pulmonary rehab to be really accessible for everybody. We know that lots of people find it difficult to go to pulmonary rehab classes if they've got work commitments or family commitments. They find it difficult to travel. So what we want is to bring pulmonary rehab closer to home for people, to have it in local neighbourhoods, to potentially have classes in the evenings and weekends. It might make it easier for people to attend.
At the moment we are developing our online programme.
Perhaps an app or a programme that allows you to do it in your own time whenever suits you. So, having options for people, so delivering it both in person but closer to home, and also having the option to do it in your own time, digitally online or on the phone.
100% do it. Don't say no, don't put it off, just get referred and get in there and get done it.
Don't even give it a second thought. Be very, very happy and grateful that you have the opportunity to get to one of these classes and just come along and enjoy it. Just enjoy it, which you will, naturally anyway.